appearing, and I use that word, staying the course right now and not removing the restrictions as they watch what this virus is doing. That's not the case across the provinces, and we have seen from Prince Edward Island to Alberta the moving away of restrictions. We're watching it in the United States of America. Is this because of science? Is this because of pressure? And what is Ontario looking at as they make those decisions? Dr. Raywat Deonandan is joining us, epidemiologist and associate professor at the University of Ottawa. Dr. Deonandan, good morning.
Good morning. How are you?
I'm okay. I'm impressed, but I'm okay. We got a lot going on here. We have Ontario not following suit, and we don't know how long that would last. When you look at the numbers, does it correlate with the decision they've made?
I think Ontario has made a very sober decision, uncharacteristically. I think it's prudent to be a little conservative in how we open things up and not to open the floodgates up immediately. We're going to be opening up relatively soon in the early part of this year. The numbers do suggest that's the appropriate path. But to do so all at once, as some provinces are doing, I think is ill-advised, not until we see the hospital capacity really recover significantly. In other countries like South Africa, after their Omicron wave, they saw a significant death wave weeks later, and we still might be in store for that. So it's best to be prudent on this measure.
When will we be out of the danger zone there? What numbers and what are you looking for?
Well, we're looking at a number of indicators. We're looking, of course, at the hospitalization status, the ICU usage, the number of hospital beds that are occupied. We're looking at the number of cases and the test positivity rate. However, that has been impaired by the lack of testing that's happening. So assuming we can get PCR testing back up and running and make it available to people who want it, then a test positivity rate of under 3% is a strong indication that the worst is behind us. We might not get there, especially since the testing apparatus may not be fixed anytime soon. So there are other avenues to go by. For example, we could look at the wastewater analysis from major cities. And right now, places like Ottawa, that has a very good wastewater analysis system, is showing a plateauing of cases, which is good, but it's plateauing at a level that I don't think it's comfortable. So if that comes down significantly, then we can start talking robustly about opening things up with passion. And I think that'll happen before the spring.
All right. Well, what kind of guardrails would you like to see in place? We had in the province of Ontario the issuing of rapid tests, and there's been, rapid tests are helpful. They're not 100%. How important is it, though, that they're way more available now?
I think it's very important, and here's the reason. By quote-unquote telling people that we're going to live with this disease, we're essentially downloading the responsibility for pandemic management onto the citizen. So wearing masks, keeping your distance, all that fun stuff. It's important to give the citizen the tools to self-manage, and that includes the tools to determine if you are a threat to other people, and that means rapid tests. So it's very important from that stead. I think what's going to happen is, one by one, the mitigation tools will be removed from the table. The lowest hanging fruit is mask wearing, and that shouldn't go anytime soon, because it's very effective and very inexpensive, and we can, again, download that onto the common citizen to manage. Other things like the vaccine passports are a bit more complicated. We have to redefine what it means to be fully vaccinated. Probably 3 doses makes sense to me. And if we can't redefine it, then we have to have a serious conversation about the utility of the vaccine passport system. And the capacity limits, that's going to go probably sooner rather than later. Because the power of vaccination is such that even if you become infected, the probability of overloading the healthcare system is diminishing. So what we have to do has not changed. As citizens, we have to keep ourselves out of super-spreading environments if we are unvaccinated and symptomatic. And if we're not vaccinated, seek out vaccination and that 3rd dose. And then hopefully all of this will go away.
It's been 2 years, and all the messages you were giving are so important, and we've been on them every day, and shows like this have been covering it. But now we're covering it with all these protests all over that are saying the opposite. Is it a new kind of a battleground there to try to control the virus?
It is, from a political standpoint, it's become hyper-politicized. It always was, but now it almost 100% is political, where the science almost doesn't matter. People will do what they're going to do based upon their desires, not based upon the reading of the evidence. It's unfortunate. I don't know what happens next. And I think the hangover from these protests might be worse than the hangover from COVID, in the sense that it'll have long-lasting divisions in society. But from a scientific standpoint, it really does underline our need to have to reinvest in public science education for generations to come, and to reinvest in public health infrastructure, as well as, very importantly, how to communicate this stuff. I think a lot of what's been feeding the discontent is an inability to understand what scientists have been saying, and an assumption that we're saying things like vaccines are 100% effective. We never said that. Or we can guarantee that if you do this, this will be the outcome. We can't guarantee anything. We just offer probabilities. So we have to reconceptualize how to deliver that message in this new milieu of opposition.
Thank you for joining us. We appreciate it, Doctor, and you have a good day.
Thank you.
Dr. Raywat Deonandan.